Hi everyone. Well, it's been about 3 months now since my surgery, and I had intended to actually update you a bit sooner than this, but there really wasn't a whole lot to tell you after the last review with the surgeon. He was very happy with how everything was healing, and we talked about potentially going on and doing a next round of surgery early next year, which is just to tidy some things up, which I'll show you in a minute. Yeah, there wasn't really a whole lot to tell you. So I thought, why don't I do a 3-month update now that it's been about 3 months? So it's probably going to be useful at this point to show you some of the scarring and what to expect from healing at this stage. So without getting too graphic, I'll try and show you a little bit. All right, so what's going on under here? This is the under breast kind of scarring area, and you can see here there's this sort of elliptical shape here, which they call a paddle. So the idea of that paddle is that that's the exposed bit of skin that was drawn up from the tummy and put inside the breast tissue, and they leave a bit exposed here, and that's so that they can monitor that during the healing and make sure that it's pink and warm and that it's got a good blood supply. But of course, as you can see, then that leaves you with that sort of elliptical shape in the scar line. It's not that you couldn't live with that for sure, but it actually is something that, generally speaking, most women want to go and have fixed up later. So they'll go and they'll actually rejoin the two sides of the wound and leave the elliptical piece of tissue not showing anymore. So that's one of the things that they might do at touching up surgery. Also, depending on the result that you get after your DCIS, if your breasts are not quite big enough, or maybe there's shallows or hollows here or there, or they're not quite symmetrical or something like that, something that might be balanced up, say, with injecting a bit of fat from another part of the body. So they might take a little bit of fat, maybe through Lipos Suction. And one of the common spots that they'll do it is around about here. So you'll see when I show you my scarring down here, so this is how we're healing at the moment. And there's often a little bit of like a fold line that you end up with here. And sometimes what the surgeons will do is do a bit of liposuction from this area and inject it into part of the breast or anywhere else that needs a bit of filling out. So yeah, that's where we're at the moment. I've got both breasts have the elliptical shaped scar there. I probably will go on and have surgery early next year to sort of rectify that. And just to show you what the scar looks like. So as you saw on the other side, it goes basically from the hip bone way over here, and there's a little bit of a fold line where that joins up there at the moment. You can see it sort of sticks out a little bit, like as though you'd done some upholstery and there was a bit sticking out the side. And then all the way through here, you can see this sort of little bit of a T-shaped one there. There's the belly button, which had to be kind of manufactured, recreated. He actually sort of had to sort of pucker up a bit of tissue there and make it look like a belly button. And also this bit of scarring that goes all the way around to there. So it's healing up pretty well, It's a decent scar, isn't it? It goes, right from one hip bone to the other, so be prepared for that. But all in all, I'm very happy with the scarring, the way it's healing. But as with anything, it's not until all of the scarring, inflammation, swelling, and everything settles down that you can really get a good idea of the aesthetics of it all, whether the breasts are balanced up, and whether the belly button's properly aligned or looks right. So if there's any tweaking required, then usually women will go on and have that stage 2 surgery. So I'll have a better idea early next year, and that's probably when I'll do my next update for you then, once I've seen the surgeon again, and that'll be 5-6 months after the surgery. We'll have a really good idea what it's all looking like and what, if anything, needs to be done, and then I'll update you with what the plan is about that. Okay, see you next time.